Postpartum hemorrhage is excessive bleeding after delivery and is a leading cause of maternal mortality. The most important causes can be remembered as the 4 T's. So you have tone, trauma, thrombin for any inherited coagulopathy, and tissue for retained products of conception. So now let's go into the detail of each of these etiologies. The first one we have is uterine atony, and this is when the uterus does not fully contract after delivery, and it's associated with multiple risk factors like prolonged labor, uterine overdistension, which might be because of multiple gestations, fetal macrosomia, polyhydramnios. Another risk factor is chorioamnionitis. So on examination, the uterus will be enlarged and boggy. And how do you manage this? So you manage it with bimanual uterine massage and uterotonic agents to stop the bleeding and to allow the uterus to contract. Then we have retained products of conception, and this is when there are placental fragments that remain in the uterus, and so the risk factors for this is when there is this certain type of placenta called a centuriate placenta. When the placenta has been manually extracted during delivery, or when there is a history of previous uterine surgery. So examination will again show enlarged boggy uterus. So even in this, the uterus is not able to fully contract properly, and the placenta has missing cotyledons. So bits of the placenta are missing. And when you do an ultrasound, it showed retained products of conception. So that is the key finding. And management is with manual extraction of the remaining pieces of placenta or DNC, dilatation and curettage. Then we have trauma. So genital tract lacerations can also lead to BPH. So it usually happens when there is an operative vaginal delivery. So that is the risk factor for this. And examination will show a laceration of the cervix or the vagina. And it might also show an enlarging. On examination, the patient might have an enlarging hematoma. So the management is with repair of the laceration. So surgical repair. Last, we have inherited coagulopathy. So thrombin is the clue, like the word for it. And in inherited coagulopathy, this can be in patients who have von Willebrand factor disease, or if they're hemophilia carriers. So if the history mentions that there's abnormal bleeding in the patient or family members, this could be suggestive of inherited coagulopathy. And on examination, there will be continued bleeding despite contracted uterus. And essentially the treatment is, correcting the underlying coagulopathy.